Good afternoon, everyone. Thank you for joining us today. I'd like to welcome you all to the Dibble Institute's second Wednesday webinar titled Scaling Up a Large Program in Rural Areas with Jill Gwilt, the Think Director from Mission, West Virginia. And my name is Rachel. I'm here with the Dibble Institute, and behind the scenes we have the wonderful Rebecca, who is helping to keep all of this running for us, handling all of the tech stuff. So thank you, Rebecca. And next slide. So before we get into the webinar, I just want to go over some housekeeping items, including the phone number and access code to use if you're unable or don't prefer to access the audio for the webinar through your phone or your computer. Also, there's going to be several ways to participate in this webinar. We will have some poll questions during the presentation, and those will show up on your screen. When they do, you'll just select your response by clicking the bubble next to your chosen item. And at the end of this webinar, there will be time for some Q&A with the presenter. So you're going to enter any questions into the questions section on the panel to your right. And we do ask that you write down and save any content-related questions until closer to the end of the presentation so they don't get mixed up with anyone who may be writing in with access-related issues. And a few days from now, you'll be able to access the recording of this webinar on our website, included on the slide here. So I'll be handing this over in just a moment, but before I do, I want to present some background information on the Dibble Institute for anyone who may be listening in for the first time. Next slide. So this is our founder, Charlie Dibble, and his wife, Helen. Charlie was an engineer by trade, and as such, he sought solutions to issues. So about 30 years ago, he was seeing how young people's relationships and those of their parents were affecting the outcomes of young people, and it wasn't always in a positive way. So he began asking lead experts in the field of education what was being done to help these young people develop skills to create stable families, and things just took off from there. So now the Dibble Institute continues his work by advocating for the effectiveness of relationship skill programming for youth and young adults, and we publish research and evidence-based relationship education materials. Next slide. So Dibble is a national nonprofit mission-driven organization, and we're able to reach many young people thanks to the efforts of all of you here and many others partnering with us. You'll see some of that work in Jill's presentation, and we couldn't have reached the over 1.5 million youth that we have in the last 15 years even without caring people like each of you. So thanks to everyone who is doing all of that hard on the ground work. Next, I just want to highlight some of our core values. So next slide. So the first is that we believe in research. So we rely on current research to keep our materials up to date and relevant, and that's really what guides the work that we are doing. Next slide. We also believe in stable, healthy families of all different types. So research continues to show that children do best when they're raised in with a healthy involvement of two parents, and that their relationship matters whether they're together or not. So again, we support stable and healthy families. That includes single parents, grandparents, adoptive parents, step, and extended family who all do great jobs and have great outcomes for their children. Next slide. And we also believe that all people deserve respect and that all relationships can be improved with relationship skills. And for the real reason everyone is here, next slide. I would like to go ahead and introduce Jill Gwilt. She's the Think Director for the Mission West Virginia Think program. So she's an innovative leader with 11 years of experience implementing and managing youth programs, including healthy relationship education, positive youth development, and adolescent pregnancy prevention. She holds a bachelor's degree in psychology with an emphasis in applied leadership, and she currently oversees 4 federal grants and 2 state grants that serve over 16,000 youth a year with evidence-based curricula. So with that, I'm going to go ahead and hand things over to Jill.
Thank you, Rachel. So as Rachel said, my name is Jill, and I've been with Mission West Virginia for over 12 years now. Keep adding on those years. And I have been the director for almost 5 years. So before we kind of jump into the presentation, I just wanted to talk a little bit about how this kind of got started. When we got our TPP 15 grant, we were asked to participate in a federal case study because of our setting. So in West Virginia, because our population is so small, we are considered all rural. And then we also serve over 12,000 youth in that type of setting. So because we're one of the largest grantees in the nation, they wanted to kind of see how we were able to scale up our program so largely and still provide quality programs. So this presentation is kind of geared towards that. Next slide, please. So just a little bit of Mission West Virginia. So they are the main organization. They are a nonprofit, and they have been operational for over 22 years. And we've been providing services to family and youth in West Virginia that entire time. We've had a little bit of everything, just depending on where the money was, and during those years. But the two main initiatives under Mission West Virginia that have remained are the Frameworks program, which deals with foster care and adoption, and then the THANK program. THANK stands for Teaching Health Instead of Nagging Kids, and it was actually a group of teenagers that came up with that name during a focus group. We have been providing youth programming for over 12 years, and as Rachel said, we currently have 6 grants, 4 federal and 2 state, and they're all geared towards teen pregnancy prevention and healthy relationship education. To date, we have served over 100,000 youth with full curricula. With community events and things like that, we've probably served over about 200,000 total. So now we are going to kind of take a poll to see what kind of grantees we have on this webinar. And if one of your if you are a different grantee than what's listed on the poll, if you want to type in what type of grantee you are or what kind of organization you work for in the question box, feel free to do that so I kind of know who my audience is. Rebecca, can you start the poll, please? And we'll give you about 10-15 seconds to answer the poll or to type in what type of grant or organization you are with in the question box. All right, so it looks like we have, majority is other, but we do have quite a bit of CPP and SRAE grantees on the call. So our organization has 2 TPP grants. We also have 2 SRAE grants, and we have a Title V and a PrEP grant. We used to be a Healthy Marriage grantee as well, and we've had a community-based grant. So we've had a little bit of everything, but right now we are federally and state funded mostly. So thank you for taking the time to answer that, and we can go to the next slide. All right, so just a little bit of background on how we got started with our TPP program. So the THANK TPP projects, and that's what we're going to be talking about the entirety of this call, is the TPP 15 project, and that's where we serve over 12,000 students a year with full curriculum. So we are in middle schools and high school students. We are in 15 high-need counties, mainly in the South. And, every organization, every grant kind of figures out a best way to bring their program to scale. And these were the 3 that we were looking at. So community characteristics and needs, existing resources, and specific capacity of partners. And we're going to break down into each of those categories. Next slide, please. So some of our community characteristics. As I said, we are all rural communities. Majority of our population is white. We have some pockets of different races, but we are probably about 90% white in the state. We have extremely high poverty rates. One of the counties that we're in is McDowell County, which tends to make national news for their high poverty, high unemployment, low education rates. And they had one of the highest teen birth rates when we started. I believe it was 101 point something, and they are now 50 something teen birth rate. So they have been cut in half, and we do take credit for that because we are the only program that does teen pregnancy prevention in McDowell County. Just a little disclaimer, some of this data will be back from 2015 because that's when the case study was done. So they used data from 2015, which was the most current year. So we had the 8th highest teen birth rate in 2015, and our program is broken up into 3 regions, which I will explain here in a few minutes. Next slide, please. All right, so these are the 3 regions. So we have 2 partner agencies, which I will talk about here in a few minutes, but they are Raynell Medical Center and Community Action of Southeastern West Virginia. And you can see that Region 1 is Case West Virginia. So they are in Monroe, Mercer, McDowell, Raleigh, Summers. And you can see what their teen birth rate was back in 2015. That has since dropped. Region 2 is Mission, West Virginia. That is me, and those are the counties we are in. And then Region 3 is Raynell Medical Center. So we all each have a little cluster of counties that we serve that makes up the TPP program. Next slide, please. So the next characteristic we will look at is we have existing teen pregnancy prevention programs in the state. We are not the only ones. We are the largest provider of teen pregnancy prevention, but some of the other programs are the Adolescent Pregnancy Prevention Initiative, School-Based Health Center, Title V clinics, Sexual Risk Avoidance Education, and there's also the Adolescent Health Initiative. So the reason we looked at these is because we don't want to duplicate services, obviously, and we wanted to partner with these programs to make sure that we're not stepping on toes, that we're not trying to enter sites that they're already doing. And we were able to partner with all these organizations and all these other grantees, and it worked out really well because we formed a statewide coalition where we all come together and we talk about the programs we're doing, and we talk about ways to not duplicate services, but to reach more youth and more counties across the state. So next slide, please. And then the last characteristic we looked at was our implementation partners. So we have been working with Community Action of Southeastern West Virginia, which is CASE, and Raynell Medical Center, which is RMC, since 2007. However, they were the leading organizations in teen pregnancy prevention. They've been doing this for 20 plus years, whereas Mission West Virginia kind of came into the program in 2007, and we were just the fiscal agent in the beginning. We did not start implementation until about 2010. And we started with 1 educator at Mission, West Virginia, and now we have over 20 at Mission, West Virginia. Our entire program has probably 35 to 40 educators alone. Next slide, please. All right, so this is kind of just a breakdown of our TPP organizational chart. When I looked to see what some of the people were looking for in this presentation, it was, how do you manage such a large grant? So this kind of gives you a breakdown of how we operate. So Mission West Virginia is the grantee. We also do implementation, but that's where the most of the management lies. So we have me, which is the director, and then we also have a community outreach coordinator, which I will talk about in a second. And we have a program analyst as well, which helps with our survey administration and ensuring that we follow fidelity. And then our evaluators are AMT and Associates, and I have to give them a shout out because they are a huge part of why we are successful. They are with us from writing the grant to program setup, implementation, scaling up, fidelity, surveys, reporting. We couldn't do what we do without them. And then you'll also see our 3 implementations. So Mission West Virginia, CASE, and Raynell. So while we, Mission, have a lot of management, each sub-partner also has a manager. We call them regional coordinators. They oversee all of the health educators, and they also help oversee programming. So that's kind of a little bit of the breakdown of how we have it set up so that it works and that we all meet the goals that we need to meet and carry out the fidelity that we are required to carry out. Next slide, please. So kind of how we do this, because our partners are in different areas of the state. So we are kind of central. Mission West Virginia is a little bit central. Raynell is in the eastern side, but east-south, and then CASE is in the very south. So the way we kind of coordinate grant activities and work together is we have annual meetings with all the Think TPP staff. So we do a kickoff every year where we all come together and go over our policies and procedures, any issues from the previous year, successes. We also talk about anything that's related to the grant. So we talk, trauma-informed care every year. We also go over inclusivity every year, safe and supportive classrooms. We go over sexual assault and consent and suicide prevention. Anything that the staff need, we will provide that training at kickoff. And then we also do an annual think meeting where they all come together from all of our programs and have a chance to talk about all the different programs and get more training. We also have quarterly leadership meetings, more than that really, but mandated quarterly leadership meetings that I meet with the regional coordinators and my management team to just make sure everything's going smoothly. Are there any issues that we need to address? Do I need to come do a site visit, or do my partners need any type of special help or anything like that? So our evaluation team has created a centralized performance measurement system. It is called the Online Participant Tracking System. That helps so much with coordinating grant activities because I can see in real time everybody's classes, everybody's sites, everybody's attendance, how many are completing. That's also where they enter their fidelity reports. Observations are also entered into the system. And then all of our referrals, because we do use referrals, are also entered into the system. So I can get in and look and see, is there an issue with fidelity with a certain site or a certain educator? Is somebody not doing referrals? Is somebody having low observation scores for some reason? Do they need to get some mentoring or additional training? And then obviously we have a lot of trusted partnerships, which I will talk about here soon, and a statewide CAG, which I will also mention here soon. Next slide, please. All right. So this is where we will get into the nitty-gritty of scaling up. When it comes to the TPP program, OAH, which is now OPA, had 4 elements of what they consider scaling up projects. So these are the 4 criteria, and we will go into each of those. But first, I just wanted to do a couple of slides to explain a couple terms so that you'll understand what I'm talking about. Next slide, please. All right, so the next slide, we've kind of already talked about this, but it gives a breakdown of Mission West Virginia, and then right now, in case you're under us. And then our Leadership to Prevent Teen Pregnancy Task Force, that's the statewide CAG that I had mentioned previous. But we also have 4 community CAGs and then 4 community youth leadership councils. I'm going to explain those here in a second. I know I'm using a lot of abbreviations, so if there's anything you don't understand, feel free to type it in the question box, and I will be sure to answer it after the presentation. So this gives you a breakdown of the curriculum we use and who we deliver it to. So Love Notes is for high school, and then we use Draw the Line, Respect the Line for middle school. Draw the Line, Respect the Line is a 6th, 7th, and 8th grade curriculum that build upon each other. So we are able to reach every single middle school student in the middle schools we are in every single year. And that's part of how we have such large numbers. And then we also do referrals to youth-friendly clinics. So next slide. All right, community advisory group. So I don't know how many of you have ever heard of this. It might be called something different in your area, but basically a requirement of this grant was to develop a community group that is focused on all parts of our program. So they are the ones who help us assess our curriculum. They help us plan on how we're going to get into schools. They help us design our program. And then they also help evaluate our program. And they're a big part of capacity building and sustainability. So we try to get key stakeholders and leaders in the community, whether it's teachers or other community youth organizations, politicians, principals, anybody that you believe has a passion for youth and is a mover or shaker in the community would be a good person to have on your community advisory group if you do not have one. So because they are also going to help with one of the key aspects of scaling up, which is community mobilization, which we'll talk about here in a minute. But your CAG is basically in charge of community mobilization. So you really want people who are passionate and willing to work. Next slide, please. The Youth Leadership Council. So youth need a major voice in these programs. And, back in 2010, this wasn't such a huge focus with the TPP program. It really started in 2015, and we've seen all future funding since then really have a youth focus. and it's really helped our program. It took a long time to get the YLC set up, and it took a lot of work. I'm not going to lie. It's hard to get kids together in one setting. And, you know, they're passionate, but sometimes it's travel, you know, especially here. We don't have buses we don't have city buses. Kids don't have their license, so it was really difficult to get youth leadership councils. But really, you need that youth voice. You need youth who are already passionate about the message you're trying to get across. And it doesn't just have to be teen pregnancy prevention or whatever it is you're trying to get across, but there are a lot of high-risk behaviors that can go along with that. So we care about drugs and alcohol and healthy relationships and communication skills and suicide prevention and mental health. So as long as you have youth that care about what their peers are going through, tap into that. They're really the eyes and ears in the community. They're the ones that can tell you, hey, this is what will work. This will help get youth more involved in the school, or this will help get more youth involved in the community. You know, if you don't have a CAG or YLC and you are grant funded, I know sexual risk avoidance doesn't really require it. I'm not sure if the new Healthy Marriage grants will, but I recommend you having them even if it's not a requirement. And we will talk a little bit more about how much they're involved in the entirety of the program. But without our CAG and YLC, we would not be serving as many youth as we're serving, and we wouldn't be in over 100 sites. So we're going to do a little bit of another poll just to see if you all have a CAG or YLC. So Rebecca, if you don't mind putting that up, and we'll let people answer. And like I said, you might call it something different, but it's, you know, if you have something similar, then you can answer that you are a part of that type of group. All right, let's see. So it looks like we have 46% are a part of community advisory groups, and youth leadership, 33 youth leadership councils, and then 38% neither. So that's a majority of the poll have either a YLC or a CAG or a part of one. I really can't express enough how important they are. And I'm going to talk about an easier way to actually form these groups here in a second. Next slide, please. All right, so this is where we jump into the actual criteria of the 4 criteria that I mentioned earlier about the scaling up. So the first is evidence-based programming, obviously. I mean, that's a big part of what we do is provide education and programming in schools or in community centers and juvenile detention centers and group homes, whatever the setting is. We only use evidence-based programming in our program or evidence-informed. So I'm kind of going to walk through a little bit of this because evidence-based programming is not just about the curricula that you use. For us, it's about everything listed here and probably a lot more. But, you know, we're a little tight on time, so I didn't list everything. So one of the things with choosing the best evidence-based program, you really need to get your community and your youth involved, and this is where your CAGs and YLCs can really come in handy. A lot of grant applications now require you to talk to the community, show that they actually want this program, show that there is a need for this program. So our CAGs and YLCs are with us from the beginning. From our new grant applications, they literally go through and they tell us, no, that county really isn't going to work. You're not going to be able to get into the schools there or whatever the case is. Or yeah, this county really needs you. They've talked about needing this type of program. This is the type of curriculum that I think they need, and this is why. But then we take it to the youth. So our community members are saying this, but what are the youth saying? Because it could be 2 totally different things. So this is where the youth will help us choose the curriculum. So we actually use them. We'll take copies of our curriculum that we have chosen, and we have actually changed our curricula twice in this program because the youth and our community members did not agree with what we had chosen. So They are a big part of that. And honestly, if we would have went with the curricula that we wrote into the grant, probably would have gotten kicked out of schools. So it was a good thing that we talked to the community members, we talked to the youth after we got funded, and we're like, will this work? No? Okay, let's find something different. And we found something different. It was better, but it still wasn't what we wanted. And then Love Notes came out, and it was approved. And being a previous Healthy Marriage grantee, we knew about Dibble. We'd already had a partnership with them, and we had seen what their relationship education had done with the youth that we had served with Healthy Marriage. And we saw an interesting decrease in sexual activity with that curriculum, even though it wasn't technically geared towards that. So when Love Notes came out and it had more of the sex education in it, we were very interested. So we took that to our schools and our community members and our youth, and it was the top pick because our students and our principals were all saying basically the same thing. They are seeing unhealthy relationships in their schools with their peers, and that's why they're engaging in sexual activity. So we were done with curriculum that just focused on STDs and contraception and refusal skills because that's kind of a Band-Aid. It's great skills. We still talk about it, but we really wanted to get to the root of the problem, and that's what Love Notes does. It talks about, not only relationships, but they learn about their self. They get a lot of self-worth and self-esteem through this curriculum. They really kind of start learning who they are and what they're willing to put up with. We have broken up a lot of unhealthy relationships. I am not sad to say, and that's awesome. One of the things that this program focuses on is abuse. And a lot of our teens, especially here, don't understand abuse. They understand physical abuse, but when it comes to mental and emotional, they have no idea. So that is an eye-opening lesson. We get a lot of conversation. We get a lot of kids who stay after class and talk to our educators, and that's a lot of where we send the referrals and provide more help because they are in unhealthy relationships. So I've kind of talked about the choosing the best curriculum. And how to integrate into your school system is to really talk to your school system. This is where you're going to be doing it. Ask them. Get them involved with your decision because then they'll feel like it was their decision and not just yours. So get them involved. Let them read the curriculum. Pick a curriculum that also addresses other factors that might be going on in their school. One thing you might want to look into is particular laws that your state might have. One thing that West Virginia just implemented is every single student in every single grade has to get body safety and consent education. Well, guess what? Love Notes does that. So we are able to go into new sites and say, hey, we've got this program. We can cover this for you if you'll let us into your health classes. And it works. So find other ways to get into the school system if you are having trouble. Find things that they need that relates to what you are already doing. So one of the other things is achieving the scale by coordinating with other grant programs. I already talked about this. You really want to find what else is going on in your state, in your county, in your zip code, wherever you're serving, because you don't want to create bad relationships. Become partners with those people. Set up meetings to talk about how you can work together and instead of stepping on toes. And this is kind of where I talk about scaling up. So I keep mentioning that, but what does that actually mean? So when I became the director in 2015, was when this program was starting, I figured scale up meant go to every middle school and every high school in the counties that we're serving and serve as many kids as possible. In my head, that's what it meant, but that's not reality. Scaling up really means that you want to find community buy-in. So that is another place that your CAGs and your YLCs will be a huge part of. They are what's going to get your community buy-in. They're going to get you into the schools. They're going to get you into events in the community. They're going to get parents to buy in so that you're not getting parent phone calls about the curriculum that you're choosing. So scaling up really means not just scaling up in the schools. You really want to be, your educator, your staff need to become part of that community. They need to go to community meetings, whether it's Family Resource Network meetings. I don't know if everybody has that, but we have that in our state. Any type of community meeting, substance abuse coalition meetings, teen dating violence meetings, anything dealing with youth, send your staff to, become part of that group so that your name is out there associated with helping that type of situation, and find ways to partner together for events or for marketing or campaigning, work together and help each other out. So that's really what to scale means. And it took a long time for us to wrap our head around that. So you really want to use your CAG and YLC to help that buy-in and to help bringing your program to scale, because you can't do it without community members and you can't do it without youth supporting your program. So the last factor I have here on evidence-based programming is basically it's evaluation. So we do quality assurance surveys. So we do pre and post surveys. We are heavily evaluated. We just choose to be heavily evaluated. A lot of federal grants require evaluation, but we tend to go a little bit beyond what the requirement is because we want to make sure our program is working. So we don't just do pre and post surveys. We do teacher feedback forms. We do site satisfaction surveys, observations. What else do we do? We also do focus groups with not only our youth, but we do them with our CAGs and our YLCs, because we want to make sure that we are providing the CAGs and YLCs the information and help that they need to carry out their goals for our program. So we do key informant interviews as well. So basically any type of evaluation to better our program, we do. And if there is an issue, we try to fix it. We're always trying to improve our program. Next slide, please. All right, mobilizing the community. So this is the second criteria for scaling up. And it has 4 approaches. Sorry for all the different numbers inside of numbers. So we're going to break all these 4 down with mobilizing the community, but really mobilizing the community is really, really, really about your partnerships. Partnerships are very important, and you're really going to use your CAG and your YLC. Next slide, please. All right, so first, when you're mobilizing your community, you need to have an infrastructure to support community mobilization because it is a huge task. We did not realize that going into this grant, probably the first year, how big of a task it was to do community mobilization. So we actually have a staff person. She is a community outreach coordinator, and her sole job is community mobilization. It is to be in charge of the CAGs and the YLCs and to go to all the community meetings, all the CAG meetings, and then to pull together the CAGs and the YLCs to create events, to create outreach, and to create marketing. So you really need to figure out the best way that would work for your organization to create that infrastructure. For us, it was this position, and it was the CAGs and the YLCs. Next slide, please. Next, this is where I'm going to talk about making it easier to have a CAG and a YLC. You don't have to recreate the wheel. So tap into existing groups. So, for example, our partner, Raynell Medical Center, already had a large community organization or community coalition called the Impact Youth Coalition that they were already a part of. So what we did is we tapped into that, and we added more members that were more geared towards teen pregnancy prevention. So now that impact group is our CAG. And so we all work together, and they have substance abuse people on that impact. They have, political leaders, they have teachers, they have parents, they have people from family resource networks. They have all kinds of issues related to youth, and now they're all coming together to work as one. The regional coordinator for this group said it's easier to piggyback on another group than forming one from the ground up. We brought some other people in this time, Board of Education, social workers, mental health workers. It seemed like the perfect fit, and it is. So you don't have to go out and create your own. You can tap into other groups and make it work for what you need. Next slide, please. So becoming a trusted resource. I've kind of talked about this. Partnerships are hugely important. And then offer up your services that aren't just related to being in the classroom. So one of the things that we've done is teen expos. So our youth in our schools, our YLCs in our schools have, there's all these issues facing youth today, and we can't address it alone. So we asked them, what do you want to do? So they created this teen expo. We do it with several schools. It's usually high schools. We do it with some middle schools. And the YLC actually picks the topics that their peers want to hear about, and then we go out and find all the professional speakers to come in and talk to these kids. And we set up a whole day of sessions for these kids to choose from. So it could be mental health. It could be how to fill out a college application. It could be financial literacy, healthy relationships, consent. Whatever the youth decide they want to talk about, we will bring that in. And we've done this several times. So we became a trusted resource, not only to that YLC, but to that school. So now when they have something that comes up, they reach out to us. Ask us, how do we find that? Can we provide that for them, or do we have a partner agency that can provide that for them? So become that trusted resource. Become partners with your substance abuse coalitions, with your domestic violence coalitions, with your human trafficking coalitions. Any type of program that is involved with youth, become a trusted resource with them, because then your schools or your sites will reach out to you, and you can call your partner and be like, hey, this school needs this. Can you help? Next slide, please. So this is another way to not reinvent the wheel with your YLC. So because of West Virginia, and like I said, we don't have a bus system, we don't have, transportation is a huge issue. So getting students from one school to be able to meet up with someone from a different county was just not going to work for us. So what we did is we actually have in our school systems already formed groups. So we have SAD chapters, and that's Students Against Destructive Decisions. It is a national organization. If you have never heard of it and you are in the school system, I would look in to see if your state has a SAD chapter. And if not, I would see about forming one. It used to be Students Against Drunk Driving. Some of you might be more familiar with that, but they changed it to include more high-risk behaviors. So we use those as our YLCs because they're already doing our messaging. Another one is a Student Advisory Council that is in one of our counties in Cabell County. And then we also have in schools YLCs with lunch and learn. So we go during their lunchtime, we bring them food, and then they're there to help figure out what their school needs during the lunch and learn. So one of our SAC groups, YLC members, they did a campaign called Together We Can. And so this is her quote. Sorry, I have dogs here if you hear them barking. It says the campaign is called Together We Can, and we're kind of saying that it takes a whole community to work with our youth to help them succeed. If you're a store owner or the store clerk and this kid comes in and looks all sad and stuff, you can talk to him about it, or you're the parent of a child. It's your responsibility, and it's the teacher's responsibility. It's everyone's responsibility. In our state, there is an initiative trying to create trauma-informed classrooms. So they are trying to make sure that not just the teachers receive trauma-informed care, which we are actually helping with, but also bus drivers and cooks and custodians, so that everybody who interacts with this child can notice a warning sign and help that child. So that's kind of what they were trying to do in this county, and the youth came up with this program. So that's pretty amazing. Next slide, please. All right, so the next number 3 on the 4 criteria scaling up is linkages to referrals to youth-friendly healthcare services. So when we go into our classrooms, we trigger a lot of issues that they might be having with our talk of healthy relationships or communication skills or teen dating violence or consent, and we tell them beforehand what we're going to be talking about so that they know. So we really want to ensure that they have help after our class, and that's where the linkages to referrals to youth-friendly healthcare services comes in. So with this, it's very important to create partnerships with any of your referral sources. So we have a really good relationship with our Title X clinic, which is obviously a youth-friendly clinic that does STD testing, STI testing, birth control, and all of that. So in our state, they actually go out and do assessments of the clinics, and then they provide us with the results so we know which ones are youth-friendly. So that is a really good relationship we have. If we ever send a child or a youth to one of these clinics and it was not youth-friendly, we report back to the state, and then they step in and take care of it. Next slide, please. This is just the assessment. This is kind of what they go over with each clinic. I'm not going to go into detail about that because of time limits, but I just kind of wanted you to see some of the questions that they ask to make sure it's youth-friendly. And these are also some of the questions that we ask when we go into clinics, whether it's mental health facilities or if it's, healthy relationship facilities, teen dating violence, that type of thing. We want to make sure our youth feel safe to the referrals that we are sending them. Next slide, please. So we do referral assessments. In the beginning, we kind of just left it as if a kid raises their hand or comes up to us, and we just realized that obviously wasn't a good way to do it. Kids are embarrassed to ask for help. So we do not anonymous, but we do these assessments where they can just check off what do they need. Every student has to fill one out. They at least have to put their name, their school, and that information, and they can either check off that they want they want some type of assessment, some type of referral, or they're not healthy. They are not comfortable filling it out. So at least everybody's checking something off so other kids don't feel embarrassed if they are having to check off that they want some type of help. We have a referral guide for every single county that we're in. So we know of every single family planning clinic. We know of every single mental health facility, every single mental health facility, etc., that we can refer the youth to. We also coordinate a lot with our school counselors and teachers because we leave and they're there. So they need to know what's going on. And then there's obviously challenges to this, whether it's the kid doesn't want to fill it out and they do need help, or, the teacher or the counselor doesn't really want to, help us in the situation. There's going to be challenges providing youth-friendly healthcare services with any program. You kind of just got to adapt, and that's what we've done with our assessments. Some of our schools have school-based health, so we make sure that we put that on the assessment, that if there is a school-based health in their school, that they are more than welcome to go to that school-based health. But if they don't want to because of confidentiality issues or whatever, they can come talk to us, and we will get them the help that they need. Next slide, please. All right, this is the last criteria for building to scale, is safe and supportive environment. So what we do is, one, all of our programs are inclusive. So we are LGBTQ inclusive. We do not shame. We do not ridicule anybody. We are inclusive of all youth. We are also very, very trauma informed. We go through training after training after training of trauma informed. You cannot have too much trauma informed training. We've actually had so much that our educators now train in trauma informed strategies with the teachers because they struggle, because at least in our state, they are not just teachers anymore. They are therapists, they are counselors, they are helping provide food to the students. And so it's a big undertaking. So we train teachers on how to handle that, and then also how to take care of themselves. So these are the three main strategies that our educators kind of came up with when entering the classroom. So set the tone right off. Let them know kind of what you expect and that you will respect them, and they need to respect you and respect each other. Also know warning signs. So know that if a kid is acting out, it might not just be because they're a jerk. It might be because maybe last night they stayed up all night taking care of their sister because mom was passed out high. So just kind of knowing those warning signs of what to look for and how to de-escalate the situation. And then be aware of students' histories. So this is a good place to talk to the teachers. Ask them if there's any student that they're worried about that maybe needs some extra help or that they should be aware of. If that kid's sleeping, leave them alone. There's a reason that kid's head's down on the desk. It's because he was up all night working 2 jobs trying to provide for his family. So it's important to know that going into a classroom or going into a setting. And then there's always going to be challenges with safe and supportive environments that you can't control. If you're in a site, like when we go into classrooms, we can't control what the teacher has hanging up on their walls. We can't pull down their posters. Unfortunately, some teachers post things that follow their beliefs that really shouldn't be in the school system. We can't do anything about that. What we can do is make sure that the students know. I'm very sorry about my dog barking, if you can hear that. But what we try to do is let the student know that we're not there to judge them, that we are there for them, and that whatever they're going through, whatever they're trying to figure out, we are there to support, and we will help them. It might go against what the teacher believes, and we've actually had that happen, and the teacher rolls with it. The teacher says, it's not what I believe, but it's what, Miss Becky believes, so you just listen to Miss Becky and she'll teach on it. We've had that happen. We've had to talk to teachers about our program, and this is what we believe, and this is what we teach. So that more relates to kind of inclusivity than anything. That will pop up a lot. Next slide. All right, so this is a summary and lessons learned. I'm trying to keep on track, so I'm talking really fast, so I apologize. So kind of summarizing is really, really, really form partnerships and figure out ways to work together. Really tap into that existing infrastructure. So if you already have community organizations already formed, tap into those. Don't recreate, coalitions that someone else is just going to have to go to another meeting that pulls them away from their work. So really tap into those existing coalitions, those existing student advisory committees or whatever that are already built. I really suggest that, you look into the SAD chapters because they are amazing to work with, and the students become really, really involved. In one of our schools, there was a suicide, and so it was a SAD chapter decided that the school kind of wouldn't let them talk about the suicide. They didn't want them to talk about it. They didn't want them to even mention the word suicide, but I won't get into that. So what the SAD chapter decided to do in a roundabout way, talk about it, was put positive messages and inspirational messages on every single kid's locker to let them know somebody cared. And that was their whole, they came up with that themselves. So it is vitally important to tap into those types of groups. They will help you so much, and you will help them. And then obviously, make sure you pick the right curriculum. Like I said earlier, we probably would have gotten picked out of schools if we would have went with the curriculum that we wrote into our grant. So really, really get input on any type of curricula or handouts or anything you create. Get input from your schools and your youth, because they will tell you if something seems off or they're just not going to allow that in their school. So really let them help. I think that's pretty much it for summary and lessons learned. One of the biggest things is be adaptable. We've really learned how to be adaptable. Things change year to year. We have to improve our program every year. It's not saying our program isn't great. It is, but there's always room for improvement. So you kind of got to learn to roll with the changes and just figure it out as you go. And if you are a federal grantee, talk to your FPO. I know it's scary. That's Federal Project Officer. I know that's scary, and it can seem like, well, they're going to think that we're a failure. That is not the case. We thought that too, and it's not the case at all. They've helped us a lot, and they have a lot of good ideas because they have other grantees that are probably going through the same issues. So that pretty much sums up, I think, my webinar. Next slide. Let me make sure. Yes, so now we're at the questions. I'm not sure if Rachel kind of takes us on But any question that you have to ask me, I will try to answer. And if we do not get to all of your questions, we will make sure that we get to them through email in some way.
Perfect. Thank you so much, Jill. That was super informative, and I found it really helpful. So I'm sure many other people who are on today did as well. So I'm just going to give just a minute for people to go ahead and write in the chat box some questions, or write in the question box. Y'all did a really great job at holding off until the content related questions until the end. So round of applause for everybody who's on today. Okay, here we go. We've got some questions coming in. So one of them is, where are your community action groups operated?
So our advisory groups, or action groups, whatever you want to call them, they are kind of everywhere. So it is community members. So for example, one of our, oh, sorry, my screen just changed and that messed with me. So one of our community advisory groups is actually a substance abuse coalition in one of our counties. And so we just brought in other partners to that substance abuse coalition. So we have our coalitions in pretty much every county that we can have them in. Some counties are multiple counties. Some counties have 3 or 4 counties in that one coalition. So we just try to find a central place to meet for free. So we don't have just one, if that makes sense. We have several. One, because of the way we're situated. It takes, 2 hours sometimes to get to the other county. So it's impossible to travel that much for one coalition. Now, our statewide coalition, we do meet in one location, and that is bringing people in from all over the state. And they do travel for that one. And we meet 4 times a year for that. Hopefully that answers your question.
Awesome. Thank you. Lots of comments, by the way, of really enjoying the presentation. So I want you to know that. Those are also coming in. Another question is, how do your youth connect with the Love Notes curriculum? So how do they respond to the program?
Absolutely. They absolutely love the program. I promise I'm not getting a kickback from Dibble. I swear I am not. But we really, really, really believe in Love Notes. They really connect with the relationship aspect. I'm not saying that they don't connect with the STD. You mentioned the word sex to teens, and ha ha ha, they're obviously listening. But they love the program. We've had, this is going to sound crazy and drastic, but we've had kids say that we've changed their life, that, they've ended unhealthy relationships, or they realize now that they are worth more than what they thought they were. And they're going to start making better decisions. We've had kids say they're going to stop engaging in sexual activity. They're going to go get tested. I can't spout enough how much positive feedback we get about this program. We hardly ever get negative feedback, honestly, about the program. And even the teachers sit there and ask us questions because they want to take stuff home, which is awkward, but that's just
So it sounds like everybody's learning when you all go out to teach this.
Yes.
Okay, let's see. So when you're creating events like the Youth Expo event, how are you going about getting funding for events like that?
They're free. So all of our partner agencies come in and present for free. I think part of the reason is they're so passionate about youth, for one, but that gives them a way to also kind of connect and get numbers for their group or their grant or whatever they have going on. And it also gets their message across and gives them marketing. So you kind of got to spin it. And if you're having trouble with maybe getting people to come and do something for cheap or something for free, is, really tell them, well, this will benefit you as well, because you're getting numbers for you, you're getting outcomes for you, you're getting your message across to, 600 youth that you normally wouldn't have, because we're getting you into the school. So all of our presenters for the Teen Expos are free. We do not incur any cost for those.
Awesome. So sounds like really leaning on those community action groups and those partnerships is really helpful.
Yes, that's why I talked so much about them. They are so important because they will help you out so much, especially with events and the teen expos or anything that your youth kind of come up with that maybe they want to do,
Hmm.
using those partnerships. And really, if you have working with youth, you need those partnerships for just help, because you aren't the person that can do everything, and you shouldn't be that person. So just having those partnerships to refer the youth to other people that can help them.
Okay. And then another question. So did you start off by being kind of spread out across counties, or did you start small, like in your county, and then grow out from there?
So we did start small. When Mission actually started implementation themselves, we were in one county and one school. And that's it. We served, I think, a couple hundred maybe in a year, if that. I don't even know if we served that with our first implementation. And we've kind of just grown since then. And so that's something, you know, I know a lot of people have, especially in rural settings, because when you come with rural settings, you can kind of, it's hard to get in there. It's hard to get into that fight, especially if you're not from there. But finding that one site, just work on that one site, that one school. If you can get into them and you do a good job, that word of mouth means more than anything. And if you can't get in with full curriculum or whatever you're trying to do, offer something else. We've had that issue where they're like, we don't really want full curriculum. Okay, how about we come in and do this for you? It looks like you know, this is a state law. You have to provide this anyways. We are trained in it. We can cover it for you. And then once they see what a good job you do, they're going to be more likely to let you in their classroom.
Good point. So on a similar question then, how many years did it take to reach the target numbers for the grant as you grew?
Oh, so all right. So we went from in 2007 with our partner agencies. Now Mission wasn't doing implementation, but right now in Case were. I think we were serving around 3,000 youth at that time. And then we grew to about 5,000, and now we serve over 16,000. I mean, it took time. It took steps. It's not easy to do, and it takes time to do, but just don't give up and keep looking for funding. You know, one of the, I won't get political, but our teen pregnancy prevention funding was illegally cut on the federal side a couple of years ago, and we were going to lose funding, and we didn't know what to do. And so one of our community organizations, actually a medical organization, heard about it and offered us a grant to cover one of our biggest counties, just until we figured out funding. So kind of reach out to community organizations if that's an issue. Thankfully, we got the money back, but that was a scary situation for us to not be able to serve our kids. So they're going to be setbacks. They're going to be, yay, we just got a grant to serve 12,000 kids. And then there's also going to be, oh my gosh, we just got a grant to serve 12,000 kids. What are we going to do? But it is possible. And I'm here if, you know, anybody wants to talk more in detail about that. I'd be happy to have conversations.
That's awesome. And what I heard in your kind of explanation of things too, you fell back on relationships that you had built throughout the community, and throughout the state to kind of help you continue that mission in that difficult kind of in between time. So it just really seems to drive home that point about building those relationships, those community action groups, those youth leadership councils, all of the messages that you've been saying as we've gone throughout this webinar. So there are some more questions that unfortunately we're not going to be able to get to today because we are just about out of time. We have about a minute left. We've got a couple of other things to cover, but like Jill said, if your question didn't get answered today, we will make sure to follow up with you within the next week to make sure your question is answered. So thank you so much, Jill. Again, super helpful webinar, really, really great, especially with all the grants that are currently going on. So Rebecca, can you go to the next slide for me? I just want to thank everyone for joining us today. Again, Jill, for the wonderful presentation that she put on. So there will be a brief survey at the end of this webinar. It should not take long at all to finish. We ask that you do so we can continue to kind of offer the webinars that are helpful and useful to you. So Some of you also asked, this webinar will be available in 3 days. You can go to the link that you see on the slide here, and you will be able to watch the webinar. If you go to our website, you can find it there. If you've got any questions, you can email me, Rachel, at rachel@dibbleinstitute.org, or rebecca@rebecca@dibbleinstitute.org, and we'd be happy to help you as best as we can. And next slide. So we have 1 whole month until our next webinar, but there are a lot of other ways that you can stay in touch with us. You can go to our website, dibbleinstitute.org. We have funding announcements and lots of other resources available there. You can subscribe to our newsletter by texting Dibble to 22828. Find us on Facebook, follow us on LinkedIn, or you can always give us a call at the 1-800 number that you see on your slide there. And then next slide. So go ahead and look for that. We have another webinar coming up next month. So it'll be June 10th at 4 o'clock Eastern. And that's Fatherhood, Building Self-Sufficient and Resilient Families with Kim Dent and Avis Files. So go ahead and get registered for that one. And we look forward to seeing you again next month. Thank you to everybody.